Hi, I'm Dr. Zakowski, and today we're going to conduct the complete physical exam, and Steve is our patient today. And I'll start with an introduction, and I'll talk as we're going along about what I'm doing and why I'm doing it to help you better understand all the parts of the physical exam. So first, I'll begin with the introduction. I'm going to demonstrate it as though I were a student and how you should introduce yourself to the patient at the beginning. Hi, I'm Laura Zakowski.
Hi, I'm Steve Clark.
Is that okay if I call you Steve?
Please do.
All right. I'm a medical student today, and I'm going to conduct the complete physical exam, and then Dr. Smith will come in and talk with you and conduct parts of the exam also. Is that okay with you?
Certainly.
All right. Now, to begin, first I'm going to just make sure that you're comfortable. Is everything here all right in terms of warmth? Are you warm enough?
Mm-hmm, I'm fine.
Okay. And I have the door shut here, so nobody should come in. And,
okay, good.
All right. Now I'm going to wash my hands first as I start. It's perfectly acceptable to use alcohol hand wash or soap and water, whichever is easiest for you. As you start with alcohol hand wash, your hands are usually a little bit cold and wet, and you can apologize to the patient if that's true. Now, first I'm going to just take a look at you in terms of looking first at skin of the face, looking at general appearance, seeing if there's any signs of anxiety or depression, facial expressions. Also looking at general hygiene is very helpful. That can indicate that there may be a problem with the environment at home, or again, may relate back to mental health issues also. So I've kind of looked generally. Steve looks comfortable. He said he's comfortable. So I'll move ahead into the physical exam, starting first with vital signs. And I'm going to check pulse. I'm going to check here just on one side. I have my two fingers, my first and second finger here, pressed just above the thumb here, and I can feel his radial pulse. And as I'm checking that, I'm going to count for 30 seconds. And I'm watching my watch here. And after 30 seconds have elapsed, the number that I have I multiply by 2, and that will give me his pulse. Now as I just complete that, I will also check respiratory rate. And this is either visualization, watching Steve's chest rise and fall, and counting respirations that way, again for 30 seconds, again multiplying by 2. I sometimes will leave my hand right on his wrist as though I'm checking his pulse, because it's very easy for someone to be distracted by me checking their respiratory rate, and they may increase or decrease their respiratory rate unconsciously as I'm watching. So I'll just watch there, and then I'll report to the physician what the respiratory rate and the pulse are. So next I'm going to check the blood pressure, and this involves several steps, and I'll explain what I'm doing as I'm going along. First, as you look at the blood pressure cuff here, there's a mark here that says where the artery should go. This is where the brachial artery should sit, just under the blood pressure cuff. The cuff also towards the end has a range. This is the size that says that it'll fit on this person's arm. There's larger and smaller blood pressure cuffs, and we'll know once we put it on Steve's arm whether it's too big or not big enough. So first I'll locate on his arm where the brachial artery is. Always sits here on the medial aspect of his arm. It's a fairly good pulse. If you can't feel it, have the patient bend his arm just a little bit more until you find it. Then put the blood pressure cuff right over that spot where the brachial artery is. Fairly close. It doesn't have to be right over, but as long as it's in that area. Then wrap it around fairly firmly. And you see here the range shows that the end of your blood pressure cuff where it's where the Velcro is attaching is in the appropriate range here. Now, the next step that I'll do is the ball here, when I squeeze the ball, it pumps air into the blood pressure cuff. There's a screw here that turns to the right that'll not let air escape from this area. So as I squeeze the ball, the air goes here but does not escape. And then once I turn the screw to the left, then it'll let air escape out of the blood pressure cuff. My first step will be to pump air in, and then of course I'll be letting air out. I'll be using my stethoscope in order to hear the turbulence of flow through the blood vessel. That turbulence is what measures the blood pressure. When the blood first begins to flow through the artery, and I can hear that turbulence with my stethoscope, I hear a pumping sound, of course, sounds like the heart pumping. That's the systolic pressure. Then as I let the blood pressure cuff down, that sound of the heart pumping will disappear. That's the diastolic pressure. That's what the artery is pressing up against the heart. Now, so I'll listen with my stethoscope in a moment. So I'm getting everything ready here because what I want to do is pump up the cuff until the pulse disappears under my fingers. Once that happens, then I'll start listening with my stethoscope. So I have everything ready here, so I don't need to fumble around too much. Now what I will do, first turn this, put my hand right over the brachial artery, make sure the screw is turned to the right, not too tight. I want to be able to loosen it again, so I turn it just till it's just tight enough that air won't leak out. Then I'll watch my monitor on the back wall. As soon as the pulse disappears, I'll go up about 20 or 30 millimeters of mercury above that. Then I'll put my stethoscope in the same place my hand was and loosen the screw here so that there's about 2 to 3 millimeters of mercury let out per pulsation. And I heard the blood pressure first at about 130, I heard pulse, and it disappeared at about 88. Now I'm letting the screw down all the way to let all the air out of the blood pressure cuff. So his blood pressure is about 130 over 88. Now I'll take this off again. And that concludes the vital signs.